My name is Tiffany Collier, and I'm a graduate student at the University of Louisville Kent School for Social Work. And I am doing this final presentation on elder abuse, particularly elder abuse that impacts the African American community. The initial research I was able to find indicates that elder abuse is not only something that happens in the United States, but it is indeed a global epidemic. At any given time, 1 to 5% of the global population aged 65 and above are either experiencing some sort or several kinds of elder abuse or mistreatment, or they are at risk for doing so. Additionally, there are studies that indicate that there's a prevalence of elder abuse amongst minorities, particularly the African American community. Along with these particular impacts that they experience, the African American older adults also are dealing with other variables like health and economic disparities due to systemic and institutional racism. And they have a reluctance to ask for assistance outside of their family networks because of fear that they may be discriminated against racially. Going even further, I will add that 1 in 8 Americans age 65 and older are affected by Alzheimer's or some sort of dementia. And unfortunately, African Americans are disproportionately impacted by this disease. Some studies say either 2 to 3 times as many as their white counterparts. In the United States alone, it is estimated that 1 in 10 older adults over the age of 65 are experiencing some sort of either physical, sexual, or psychological abuse, or possibly financial exploitation, neglect, self-neglect, abandonment, or a denial of liberties, or participation in making family decisions. The World Health Organization defines elder abuse as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. According to the National Center on Elder Abuse in America, or the NCEA, abuse refers to any deliberate or undeliberate action by a caregiver causing serious harm or injury to an elderly person. The World Health Organization declares that this violence against the elderly is a violation of human rights and ultimately brings about the loss of dignity and self-respect. Several studies were able to identify several risk factors for victims of potential abuse, including functional dependence or disability, poor physical health, cognitive impairment, a history of past abuse, and low income with loneliness, isolation, alcohol use, or financial dependence. The risk factors associated with the caregiver or perpetrator are caregiver burden or stress, depression or some other kind of mental illness, financial difficulty, social isolation, poor relationship with the individual cared for, and substance abuse or some sort of addiction. Social workers may need to ask questions or inquire of the family if any of these factors come into play when trying to give assistance to the family of an elderly adult. There also includes factors of relationship history and close living arrangements. In many instances, it's difficult to determine if an older person is being abused in any way. They may not report because of the proximity of their caregiver, and they may feel a sense of loyalty to them. Add to that the fact that if this particular individual, if an older adult, has a degenerative disease such as dementia or Alzheimer's, they may forget to report due to ongoing memory loss, or they may no longer have the ability to communicate. In addition to the risk factors that were already mentioned, African American elderly, those who are age 65 and above, also may deal with the additional cultural factors that are prevalent within and historically within our community, which is poverty, institutionalized racism, and structural segregation, which also puts that group at risk. They may feel protective or loyal toward their caregiver. They may be in denial about the abuse that they are suffering. And they may have a natural distrust of institutions for fear of racial discrimination. Based on the evidence that I was able to find, African American elderly are twice as frequent to be suffering from psychological abuse at the hand of their caregiver, and 3 times as likely to be financially exploited by their caregivers as well. They may be coerced to sign documents that they don't understand, or they may have a suspicion that a relative has access to their finances, to their bank accounts, or other sources of funds. As much research and as many studies that have been conducted, more information needs to be found, more data needs to be gathered so that specifically studies amongst that include minorities like African Americans need to be added so that information can be gathered, cultural variables can be considered in order to provide African American families and African American elderly the assistance that they need. But based on what I was able to find, it appears that African American families and service providers can remain attentive to the socio-historical experiences of African Americans in the U.S., such as racism and structural exclusion, thus ending the cycle of violence. As a community and as social workers, we can focus on cultural strengths in order to prevent abuse or neglectful behaviors. We can be cognizant of the lasting effects of historical oppression experienced by African American populations, as well as structural racism and exclusion that continue to influence the ecology, the etiology and maintenance of abuse and neglect. Social workers and other service agencies can engage families from a collaborative stance and explore perceptions of abusive, neglectful behaviors. Social workers and other service agencies can help families identify healthcare, community, and family resources and make them available to prevent harmful behaviors. We can identify points of entry for service delivery systems located in the communities rather than expecting African Americans to reach out to formal institutions that they may not trust. Um, we can target public awareness campaigns for African American neighborhoods, and we can encourage informal caregivers, family members, um, and whoever may be working in that particular team to care for a loved one, to encourage them, and other professionals who interact with African Americans to be vigilant for signs of financial exploitation amongst this particular population. As a African American woman, and as someone who has been a full-time caregiver to a mother with dementia, I understand and know all too well the isolation and frustration and lack of resources that you may not have access to. Education is important, and connection and networks are important. Social networks are important. And as a social worker, it is important that we encourage family members to learn, to research, to take advantage of any help that they possibly can get, that it would be extended to them, to find a way to create a team, a caregiving team for the loved one that they are caregiving, that they are giving care to, and to encourage them and let them know that they do not have to do the thing alone. They do not have to suffer the caregiving experience in isolation. That there is help and that there is support if they are willing to reach out for it, for the sake of the one being cared for, as well as the sake for the individual who is doing the caregiving. My name is Tiffany Collier. I am a student at the U of L Kent School for Social Work, and I thank you for listening.